Hi everyone, I'm Minoli Ediriweera. I'm from Olney, Maryland, and I go to Sherwood High School. I play varsity tennis, and I am a certified nurse's assistant. I volunteer at MedStar Montgomery Hospital and work at an orthodontist office in my town. I also started a club at my school called Dr. Bear's Buddies that benefits Children's National Hospital in Washington, D.C. In the future, I'm hoping to become a pediatric oncologist. I also love the idea of working with a program like Doctors Without Borders, UNICEF, or the Red Cross. Today, I am hoping to discuss with all of you how climate change can impact the quality of healthcare around the world. In particular, I will share 7 environmental stressors that have strong effects on global health. I want to begin by defining climate change for all of you. Climate change refers to significant changes in global temperature, precipitation, wind patterns, and other measures of climate that occur over several decades or longer. In terms of public health, it can have devastating impacts, including limiting access to food, water, sanitation, and clean air. It hits heaviest in areas with developing health infrastructure and tends to harm children, the elderly, and those with pre-existing conditions the most. Diarrheal diseases, respiratory illnesses, and mental disorders are just a few of the health problems that can be caused or worsened by the disastrous effects of climate change. Air pollution is caused by chemical particles in ground-level ozone seeping into the atmosphere. Reduced air quality harms lung functioning. High levels of carbon dioxide in the atmosphere can also promote the spread of allergens. These pollutants can create or worsen asthma, bronchitis, emphysema, COPD, lung cancer, and other respiratory illnesses. Coughing, lung or throat irritation, wheezing, and shortness of breath are a few of the symptoms high ozone levels can cause. A variety of factors increase the risk of contracting foodborne or waterborne illnesses. These pathogens usually thrive in high temperatures and spread during extreme precipitation events. The elderly and those living near untreated water facilities usually have a higher chance of acquiring these illnesses. Toxins from algal blooms and metals in water can also contribute to birth defects and other fetal complications. Food safety laws have been put in place, but there are still many communities around the world, including in the United States, that remain struggling without access to clean water, free from lead and other harmful contaminants that may promote illness. Extreme temperature events can easily take the lives of vulnerable populations. Outdoor athletes, workers, infants, those from low-income households, and the elderly have a higher risk of suffering from heat-related conditions. Even though weather prediction methods have improved over the years, death from heat stroke, heat exhaustion, brain, respiratory, or cardiovascular damage, and other conditions caused by extreme heat still occur. According to the World Health Organization, a 2003 European extreme heat event recorded more than 70,000 deaths. Increased heat also increases the spread of pollen and other allergens, creating an atmosphere that can trigger hypersensitivity at reactions like asthma. Flash floods from tropical storms can be extremely dangerous and result in numerous drowning deaths each year. The elderly, young children, and disabled persons will be at risk during these events. In addition to immediate dangers, the after effects of floods can be devastating as well. Waterborne disease caused by contaminated freshwater supplies may be a result of floods. Buildings may become mold infested, resulting in poor air quality. Homes and healthcare infrastructure may also be damaged, weakening access to proper healthcare. These can lead to respiratory infections like pneumonia and exacerbation of asthma and other conditions. The World Health Organization claims that climate change increases the transmission of vector-borne diseases, which are illnesses spread by pathogen-carrying animals, such as mosquitoes, fleas, and ticks. Climate change can elongate seasons and expand the area in which spread tends to occur. While these illnesses occur mostly in tropical or subtropical areas, North America's frequent trade and travel to these areas have spread these illnesses globally. And North America has a variety of vector-borne illnesses like Lyme disease present as well. Wildfires can reduce air quality as it contains harmful chemicals such as carbon monoxide. Smoke from these wildfires can cause a variety of respiratory and cardiovascular problems, including asthma, chest pain, bronchitis, and other infections. Children, pregnant women, and those with heart disease and asthma are at high risk for severe complications caused by wildfires. When climate change worsens, so does the risk for wildfire events. According to the CDC, smoke from these events contribute to thousands of deaths annually and continue to increase every year. The environment can have a huge overall impact on neurological functioning. After weather disaster events, people may have increased anxiety, PTSD, and other stress-related disorders due to losing homes, loved ones, belongings, or other trauma. High temperatures negatively impact those with depression, causing a spike in suicide rates and also correlating with heat stroke and dementia patients. In addition, temperature increases caused by climate change can alter the effects of important medications, including severe schizophrenia treatments that may end up impacting body heat regulation. The most important things we can do is listen to scientists and learn environmentally conscious behaviors. Monitoring emissions from cars and the industry and choosing eco-friendly alternatives to our usual household products can control the root cause of many of these illnesses, which is climate change. In addition, building detailed healthcare plans and reliable healthcare infrastructure in areas that may be frequent victims to one of these events is important in creating resilient communities that can protect vulnerable populations. It is necessary to rebuild after disaster, but it is easier to prevent these disasters in the first place. Here are some of the sources I use that I would like to acknowledge. Thank you so much for watching. Please email me if you have any questions.